Hi, my name is Christopher Chen, and I work as a medical director for Medicaid at the Washington State Healthcare Authority. HCA administers the state's Medicaid program, also known as Apple Health, which covers over 2 million clients in our state. We value our partnership with Public Health Seattle and King County and share a dedication to addressing climate change, which is why I'm here today to talk about how healthcare systems can help our community adapt to climate change and share work going on at Public Health. What does adaptation mean in this context, and how does it differ from mitigation? You've already learned previously that mitigation is about reducing greenhouse gas emissions to minimize the healthcare sector's impact on the planet. Adaptation can be defined as anticipating, preparing for, and responding to the health impacts of climate change. We recognize that climate change is a reality that we need to live with and that we have to adapt to. Climate change is already impacting people's health. You might have experienced this yourself if you have found yourself having asthma symptoms during a wildfire smoke event, or if you've noticed your seasonal allergies are getting worse. And these impacts are projected to increase in the future. Your local public health department, health systems, and the broader healthcare sector all play a critical role in supporting frontline communities that are already experiencing the effects of climate change. Their job includes building internal knowledge of climate change and its health impacts, informing and preparing patients and broader community, and providing physical resources to reduce risks to health. We'll talk about 3 steps all healthcare systems can take: risk communications to residents, providing protective equipment, and provider education and resources. Risk communication is meant to give residents the information they need to make informed decisions about their health during a hazard. In this case, a climate-related health hazard. Here are some real-world examples. This Stay Safe in the Heat comic was co-developed with community partners. It describes the health impacts of extreme heat, who is most vulnerable, and what protective actions to take. It has been translated into over a dozen languages, and the past few summers, the graphic has been run in a campaign with multilingual and community media outlets to get information out to our most impacted community members. Public Health's Climate Changes Health comic was also co-produced with local Seattle area artists. It highlights the major effects of climate change, its health impacts, and recommends actions to both mitigate and adapt to climate change. And it's done in a clear, visually interesting format. Communications materials like these can be given to residents and patients in their spoken language to help inform and educate. This can help people make the connection between climate events and health issues they may be experiencing, like asthma or allergies. To help our community adapt, though, we need to do more than just provide information. People also need protective equipment and resources, such as box fans or HEPA filters or air conditioning units. Let's take wildfire smoke as an example. We know that having a HEPA air filter in the home is the most effective way to filter out harmful smoke particles and protect our health. So for the past couple of years, Public Health has distributed a cost-effective DIY solution to clean indoor air, a box fan filter kit. They've partnered with community organizations to distribute thousands of these kits to residents. Another adaptation example from our region is the Oregon Medicaid Waiver Program. It's the most assertive measure from a Medicaid program to fund climate change and health adaptation resources for populations at greatest risk. Starting this year, some Oregon Health Plan members may qualify for what they call climate supports, which are devices that help keep people safe during climate events. These may include devices that provide clean air and healthy temperatures, including air conditioners, heaters, and air filters. Mini fridges to be able to keep medication cold during a power outage. Portable power supplies to use during a power outage to be able to operate medical devices like ventilators. Patients do need to have a certain health condition to qualify for these supports. For example, they need to have a health condition that gets worse during hot weather to qualify for an air conditioner, or a health condition that requires temperature-controlled medication to qualify for a mini fridge. Lastly, let's talk about the importance of our healthcare providers. They are consistently seen as the most trusted messengers for health information, which creates an opportunity to have these conversations with patients to build their capacity to adapt. Do patients know what their risk is when extreme heat hits? Do they know how harmful wildfire smoke is and how to filter their indoor air? To be able to have these important conversations, providers need a solid understanding of climate change and its health impacts. These are 3 great resources aimed at providers that teach exactly that. The Climate Resilience for Frontline Clinics Toolkit by AmeriCares has downloadable resources for patients, providers, and administrators on heat, wildfires, hurricanes, and flooding. Climate MD is from the Harvard School of Public Health. It's a hub for climate change and health research, education, and training for health professionals. A physician's guide to climate change, health, and equity was developed by the Public Health Institute. It gives a foundational understanding of climate science, health equity, the role of physicians in climate change and health, and more. Another example of an initiative to address provider education is one that healthcare authority is involved in, the BREE Collaborative Work Group on Health Impacts of Extreme Heat and Wildfire Smoke. This group plans to formulate multiple recommendations for payers, providers, public health, and others in the healthcare space to cohesively respond to extreme weather events. Meetings are open to the public and we welcome you to participate. Information on attending is available on the BREE Collaborative's website. Thank you for taking the time today to learn about how risk communication, protective equipment, and provider education are key measures to address adaptation to climate change.
Thanks so much for joining us today and taking the time, but there's still so much work that can be done. We'd like to continue this partnership. Please do reach out to me and our team. Please let us know how we can support you to find resources and to do more work together.